The hidden health crisis. Loneliness and resilience in Black and Latino communities. Loneliness is quietly cutting years off our lives, yet most of us don't even recognize it as a medical threat. A sweeping new study from Howard University has just confirmed what many people feel in their gut. Persistent loneliness can wreck both mind and body, but here's where it gets controversial. While the damage is universal, Black and Hispanic adults seem to shoulder the burden differently, showing surprising pockets of resilience that challenge long-held assumptions about vulnerability and mental health. What the researchers did. Dr. Oluwasegun Akinyemi, a physician-scientist at the Clive O. Callender Outcomes Research Center, led a national analysis of more than 47,000 Americans who answered the Centers for Disease Control and Prevention's Behavioral Risk Factor Surveillance System. Sophisticated statistical tools filtered out the usual suspects: age, income, education, chronic illnesses, so the team could isolate the specific impact of feeling lonely. Think of it as turning down the background noise so the real melody becomes unmistakable. The hard numbers you can't ignore. People who said they always feel lonely were 5 times more likely to meet the criteria for clinical depression. They also recorded 11 extra mentally unhealthy days and 5 additional physically unhealthy days every single month. Shockingly, over half of the chronically lonely participants screened positive for depression, a rate far higher than most primary care waiting rooms ever see. And this is the part most people miss. Despite similar levels of isolation, Black and Hispanic respondents were less likely than their white counterparts to report depressive symptoms. Does that mean cultural support networks, extended family ties, or community faith traditions offer a protective buffer? Or could it signal that minority participants underreport emotional distress because of enduring stigma? The data hint at both explanations, setting the stage for spirited debate. Why it matters beyond the spreadsheets. The World Health Organization recently warned that social isolation now claims roughly 100 lives every hour worldwide, about 871,000 deaths a year. So the Howard study isn't an academic footnote. It's another alarm bell in a growing global chorus, urging healthcare systems to treat loneliness like hypertension or smoking. Dr. Temitope Ogundare, a Boston University psychiatrist and study co-author, bluntly states that clinicians must start screening for social isolation and prescribing connection. Think neighborhood walking groups, volunteer programs, or even art classes, just as they prescribe statins or therapy. A personal lens on a public crisis. For Dr. Akinyemi, the project was also autobiographical. Raised in Nigeria, where neighbors often feel like extended relatives, he was stunned by the American norm of sealed suburban doors and minimal sidewalk chatter. That culture shock sparked a career-long curiosity. How does the architecture of a society, its housing, its work schedules, its unwritten social codes, either cushion or amplify loneliness? What comes next? The Callender Center team plans follow-up studies that dig deeper into cultural shields and stressors. Can faith communities reduce depressive symptoms? Does bilingualism expand social circles or fragment them? And how do economic pressures intersect with race to shape feelings of isolation? Howard's historic commitment to health equity makes it an ideal launchpad for answering these questions. Practical takeaway. If you feel lonely, you're far from alone, and opening up about it is a sign of strength, not weakness. Consider scheduling regular coffee days, joining a local hobby club, or even talking with your doctor about community resources. Small steps toward connection can translate into measurable mental and physical gains. A final nudge for the comment section. Do you believe the reported resilience among Black and Hispanic adults reflects stronger community bonds? Or, if it possible, the community underreports emotional distress? Reconnect in a disconnected world. Overcoming loneliness together. In today's digital age, it's alarming to see how many people are seeking solace and companionship from artificial intelligence rather than from real human connections. Imagine a world where people prefer chatting with a machine programmed to offer comforting words over having a heartfelt conversation with a real therapist or friend. But here's where it gets controversial. Why do so many of us turn to an illusion of human interaction when the real thing is available? And this is the part most people miss. The profound impact of loneliness on our mental health and the importance of genuine human connection. The causes of loneliness. Loneliness is a pervasive issue that affects people of all ages. For young individuals, the constant use of social media and video games can erode their ability to engage in face-to-face conversations. It's not uncommon to see parents on the subway completely engrossed in their phones, neglecting the opportunity to bond with their children through simple activities like reading or playing games together. This early reliance on technology can hinder the development of essential social skills. As we age, the problem persists. Elderly individuals who often live longer lives find themselves increasingly isolated from others. The frequent use of electronic communication, such as texting, and the tendency to cancel plans at the last minute can contribute to feelings of disconnection. Many elderly people report feeling more comfortable interacting with machines than with their peers. Finding solutions. As an educator at Princeton, I believe that fostering the sense of community is crucial in combating loneliness. From the very first class of my freshman seminar, I emphasize the importance of group interaction. I enforce a no electronics policy in the classroom, encouraging students to write longhand and share their work with each other. By dividing it into small groups for discussions and having them present their findings to the class, I create an environment where communication and collaboration are valued. Groups can serve as a powerful tool for communication at any age. Book clubs, for instance, provide a space for people to explore ideas, share emotions, and connect over a common text. Language exchange groups bring together individuals from diverse backgrounds, fostering understanding and friendship. Religious communities often emphasize the importance of kindness and mutual support, making them a valuable resource for those seeking connection. Books can also be a means of escaping loneliness. Even when read alone, a book that allows us to engage with an author's perspective, explore different worlds, and find common ground with others despite our differences. And reading can be a solitary activity that ultimately enriches our social lives. The role of family. Ultimately, it is up to each of us to nurture connections within our families. Simple acts of togetherness, such as sharing a meal, playing sports, or enjoying music and art together, can strengthen bonds and combat feelings of isolation. Taking the time to walk in nature or simply spending quality time with loved ones can make a significant difference in our well-being. Understanding loneliness is the first step toward addressing it. If you're struggling with feelings of isolation, consider taking a loneliness test to gain insight into your situation. Seeking the help of a therapist can also be beneficial in navigating these challenges. Remember, you are not alone, and there are resources available to support you. Loneliness, the hidden health crisis in our hyperconnected world. WHO warning. In a world where we're constantly connected, loneliness is quietly becoming the most dangerous threat to our health. We're surrounded by screens, endless messages, and virtual interactions, yet many of us still feel profoundly isolated. This paradox, being digitally linked yet emotionally disconnected, has sparked a global health crisis that the World Health Organization, WHO, now calls a silent epidemic. A recent report highlights a startling fact. Loneliness is responsible for over 871,000 deaths annually, surpassing the toll of major diseases like heart conditions and diabetes. It's not just sadness. It's a silent killer that chips away at our bodies and minds. But here's where it gets controversial. Despite our hyper-connected lives, loneliness is growing worse. The WHO's report, From Loneliness to Social Connection, reveals a disturbing truth. Even with unprecedented access to communication tools, people are increasingly feeling alone. Imagine scrolling through social media, seeing countless likes and emojis, yet realizing you're the only one who truly understands your struggles. That's the reality for millions. The report estimates over 100 people die every hour due to the indirect effects of loneliness, a figure that rivals the death tolls from major health issues. What exactly does loneliness mean? The WHO defines it as the gap between the relationships we desire and the ones we actually have. It's not just about being physically alone, but feeling emotionally or socially cut off. Social isolation, the lack of meaningful human contact, is closely tied to this. Research shows loneliness isn't just a fleeting emotion. It's a risk factor for serious health problems like stroke, heart disease, dementia, depression, and even premature death. The report emphasizes that strong social ties act as a biological buffer, reducing stress, lowering inflammation, and improving mental well-being. Yet the root of this crisis runs deeper than technology. Despite smartphones and social media, our digital lives often lack depth. A brief message or a scroll through feeds can't replace the warmth of a conversation or the comfort of a shared meal. Tsidon Pemba, co-chair of the WHO Commission on Social Connection, notes that even young people in digital environments often feel profoundly alone. This isn't just about screen time. It's about a societal shift that values productivity over connection, urbanization that erases community spaces, and economic challenges that limit social opportunities. The WHO urges governments to treat loneliness as a public health priority, not a personal failing. They call for policies that foster community engagement, investment in research, and new ways to measure social connection. Public campaigns could encourage simple acts like starting a conversation with a stranger or joining a local group. The key takeaway? Social connection should be as vital as clean water or vaccines. If we fail to act, loneliness will continue to erode both individual health and the social fabric that binds us together. So what can we do? Small, intentional steps matter. A shared meal, a walk with a friend, or a supportive workplace can begin to restore a sense of belonging. The time to prioritize human connection is now, because in the end, our lives may depend on it. What steps will you take to rebuild these vital links in your life?